Welcome back. After losing his brother to a preventable medical condition, Dr. Joshua Budhu pursued a career in healthcare. As a first-generation Guyanese American, Dr. Budhu uses his career to advocate for health equity, addressing the disparities affecting low-income communities of color. The doctor now joins me to discuss his efforts. Dr. Budhu, thank you for joining us.
Yep. Thank you so much for having me here.
So to start off, why should healthcare for low-income communities and communities of color require a nuanced approach?
Yeah, so this is a really important question, and the reason why is that there are these things called the social determinants of health. And these are the social, economic, cultural, and environmental factors that actually really influence health and health outcomes. Mm-hmm. So these specifically are kind of where we're from, how we look like, how much money we make, our education, our health literacy, our legal status, are we undocumented or not? And all of these, we've figured out that they actually contribute much more to our overall health, about 80% actually. And as we kind of realize that, you really need to start taking a more nuanced and kind of individualized approach to healthcare. Mm-hmm. And that's kind of figuring out what resources people have and then trying to go and work with it. For example, if I prescribe a treatment and there's a $500 copay, how are we actually going to go and get that treatment if you can't afford that copay? Mm-hmm. So that's when a lot of the nuances really harken on the social determinants of health.
Absolutely. And in your experience as a Guyanese American, how has that impacted how you and your family interact with the healthcare system?
Yeah, so I will say a lot of this is kind of colored by my brother's passing. He passed away when I was a sophomore in college, and that event, coupled with kind of our experience of being immigrants from Guyana and coming to this country, really influenced the way that we look at health and healthcare. And there was this kind of big mistrust and distrust that really formed from the healthcare system. And as a doctor, as a physician now in the healthcare system, I realize that, especially when trying to provide help to and health care to communities who are often marginalized and more vulnerable, that we really need to work on that trust aspect. And that's really one of the most important things that we can do as healthcare providers.
And speaking of your brother, can you tell me a little bit about his experience with law enforcement in the health system?
So this happened in 2008, and he actually was arrested while driving under the influence. And he had few kind of scrapes, so they brought him to one of the local hospitals in Queens. And we didn't know this at the time, but he was never arraigned. He was there in the hospital for 6 days straight, and he was handcuffed the entire time, so unable to move. And he eventually died of a preventable medical condition, a pulmonary embolus, a blood clot that had developed because he was laying still because they had handcuffed him. And his experience really opened my eyes up to kind of what are the contributors to health and healthcare? Why did he land in that situation? And overall, ended up being one of the events that sparked me to do the work that I do.
I'm sorry to hear that. And in an interview with New York One, you stated the death of your brother helped you realize the social detriments of health. Can you just elaborate a little bit more on that?
Yeah. So as I mentioned before, these are the kind of broader determinants. So these economic, social, cultural, environmental factors that all contribute to our health. And when I look at what happened to my brother, it wasn't until I kind of learned about the social determinants of health and started researching them that, when I looked at him, I realized that this wasn't just some one-off incident. There was a high probability that if that didn't happen, if he didn't die then he was on the road to some other cause in the next few years. And this was kind of because of, one, his insurance status. He was on Medicaid. We were Guyanese immigrants that didn't have much healthcare training or knowledge or experience. He was overweight and kind of developed diabetes, living in the food desert that we grew up in. And all of these contributed to his overall health status. And if it wasn't this incident, then it could have been something else just a few years later.
Yeah. And earlier you mentioned, maybe prescribing somebody a treatment and them having a $500 copay, and that's just one of the many disparities. So can you just tell us what are some unique disparities communities of color and low-income communities face?
Yeah. So aside from kind of the financial differences that communities of color and marginalized communities face, a big part of actually is environmental factors. So if you think back to redlining and kind of structural issues that happened in the 1800s, 1900s, and even that are happening now, think about where the highways are, right? Across Bronx, the pollution that kind of comes out from that. And when we think about where factories are, where kind of, different kind of roadways and such, they're mainly located near poorer communities, near communities of color. And these really disproportionately affect our most vulnerable communities.
Yeah, and speaking of most vulnerable communities, how do these disparities, how do they change for those who come from immigrant or undocumented families?
Yeah. So this is an even added kind of barrier for people who are undocumented. One part really because of the insurance status and kind of the access to health care. So most people get health care through their jobs, and a lot of the jobs that undocumented immigrants have don't provide health insurance. And if you are, there is emergency Medicaid, which is for undocumented immigrants, but it's really limited just really to kind of emergent situations, doesn't provide preventive care. And for me, I see patients who are on emergency Medicaid, and for cancer treatment, it doesn't really provide for a lot of the other kind of treatments that you really need and the other services that you need to have an adequate kind of treatment for cancer.
Absolutely. And knowing what you know now and knowing your personal experience, knowing what you know now about the healthcare system, what is your experience now that you are in the healthcare system?
Yeah. So I will say it's really an honor and a privilege to be taking care of patients and to be serving the communities that I'm from. And my kind of experiences of being both a caregiver, a family member of a patient, and patient myself have given me the lived experiences that I can bring with me and figure out also how to make the healthcare system better. And this has given me kind of what I'd say a unique perspective in working on more of these social determinants of health, working on ways that we can improve health and healthcare of marginalized communities by, one, working together directly in the community, but also addressing some of these other factors, such as housing, food security, and realizing how much more that they contribute overall to health.
Of course. And I want to congratulate you because you were accepted into a program by the Drug Research Program, Bristol-Myers Squibb Foundation, to support diversity in clinical trials. Can you tell me a little bit more about that?
Yeah, sure. And so this is a grant that I was awarded it's called the Robert A. Wynn Career Development Grant, and its focus is on improving diversity in clinical trials. And this is really, really important. Because when we think about some of the cutting edge and new treatments and medicines that we're developing, we do these through clinical trials. And unfortunately, historically, and even now, the population in clinical trials is not diverse. And we really want to have representation so that the communities we are serving are actually getting the treatments that we have. So this is really important, and just providing both access to new drugs, new therapies, as well as it's just good science, because if we're not representative in the populations that we're treating, we don't know if there's differences in how people respond to different drugs. And so it's kind of a multi-faceted good thing to have diversity in clinical trials.
100%. It is very important. And can you tell me what are some of the current issues with clinical trials?
Yeah. So I'll kind of focus on one issue that I think that's really important, and it's been the historical mistrust. That's kind of, and I would say historical, but also a very well-deserved mistrust of the medical system in terms of science and experimentation. And that's the thing we really need to work on, in which clinical trials and clinical research, for example, for me as a neuro-oncologist, these actually represent some of the first-line therapies that I can give to my patients. And if we don't have the trust, if someone thinks they're going to be experimented on or thinking that they're a guinea pig, then it's just not going to work. So a big part of that is actually, one, increasing the diversity of the workforce, having people who have cultural competency, humility, and also just concordant care, speak the same language. So those are all really important issues to work on.
Of course. And what can we do to promote equity within the realm of healthcare for all?
Yeah. So yeah, this is a really important question too. And I think the things that I really want to stress is that really the awareness of how awareness of how important the social determinants of health are. And when we think about it, food is health. So food insecurity, housing is health. So actually having stable housing, and all of these things, how they contribute to healthcare. And I'll say that, so in my current work at Memorial Sloan Kettering, I work with the Immigrant Health and Cancer Disparity Service, and we're working on these interventions directly because we realize that they have impact on our patients and making sure that they are able to get to their appointments, they're able to take their medications, and overall just lead a healthier lifestyle.
Absolutely. And lastly, circling back to the story about your brother, I just want to ask, should there be something set in place to ensure the safety and health of people who have been arrested and incarcerated, and what should that look like?
Yeah. So when you want to talk about a vulnerable class and incarcerated, the incarcerated population has so many other barriers put onto them. And that's kind of one, just because they're kind of they're institutionalized, they're in the system, and there's so many barriers to get actually good preventive care as well as kind of ongoing and continuous continuity of care. So yes, I think there should be kind of better systems in place so that we can make sure that regardless if someone is arrested or if they're incarcerated, that they have access to adequate health care. And it goes back to what health equity is, and equity is that we really are striving for everyone to have the opportunity to have their best healthy outcomes and the best life that they can lead.
Absolutely. Dr. Budhu, I want to thank you so much for joining me today.
Great. Thank you so much for having me.
Thank you. To stay in touch with Dr. Joshua Budhu, please follow him on Twitter at Joshua Budhu. And to stay informed on all the works for Memorial Sloan Kettering Cancer Center, please go to their website at www.mskcc.org. Stay tuned. We have more open for you right after this.